Hi everyone, thank you for being here in the snowy weather. My name is Jenny Mancha. I'm the Outreach Coordinator for the Maryland Health Connection. So I just wanted to give you kind of an overview of the Maryland Health Connection and just talk a little bit about how that could play a part in the Faith Community Health Network. Let's see. Yeah. So our mission is to make health insurance affordable and accessible for all Maryland residents. And my role specifically as the outreach coordinator is to connect with community organizations and faith organizations to make sure that people are getting the information about how to enroll in affordable health care. So we think this is especially important because having healthcare makes people more proactive about their health and being able to access the medical care that they need. And as the Reverend Dr. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most inhumane. So it's especially important that you are familiar with the Maryland Health Connection. So if you do come across someone in your congregation, you can refer them to us so we can help them get enrolled. And we can help eliminate this barrier. Let's see. So the Maryland Health Connection is our state's health insurance marketplace that was established from the Affordable Care Act. It offers Marylanders a range of healthcare programs. This includes Medicaid as well. And so you can go on marylandhealthconnection.gov to sign up for healthcare, and it kind of explains all the programs, and we work with large carriers in Maryland to provide this coverage. We also have a program called SHOP, which is the Small Business Health Options Program. So businesses can sign up through Maryland Health Connection as well to offer coverage to their employees. And actually, this was our first year where we offered dental plans. They're called standalone dental plans, which a lot of insurance doesn't provide dental for adults. Usually it covers for the children. So it's a great service that a lot of people took advantage of this year. So part of the Affordable Care Act, as you probably know, is that health insurance companies can no longer deny coverage to individuals for having a pre-existing condition. So this allowed many more people to get quality health care. And also health plans now are required to include essential health benefits. And a few of the, Okay, and a qualified health plan is a plan that has been certified by Maryland Health Connection to meet certain standards. And these are the participating companies that we work with. Many of the names you'll know: United Healthcare, Evergreen, Cigna, Kaiser, and CareFirst. And also important is the penalty for not having health insurance, which is now $695 per person, or 2% of your household income, and it's actually whichever is a greater number. So that penalty is increasing every year, so it is more and more important that everyone get covered. And these are some of the essential health benefits, which you'll see. It includes emergency services, hospitalizations, maternity and newborn care, prescription coverage. So some of the things that you would expect in an insurance company to provide, now they are required to provide that. And how you enroll in Maryland Health Connection. So if you come across someone in your congregation that says, I need health insurance, you would refer them to Maryland Health Connection. They can sign up online, or we also have enrollment centers. And actually Brian is with one of our connector entities, which is Healthy Howard, and each region around the state has their own connector entity where you can refer people to go and enroll. We also have Healthcare Access Maryland, which works with us for Baltimore City, Baltimore County, and Anne Arundel County. Let's see. And actually 9 out of 10 Marylanders who received healthcare coverage through Maryland Health Connection were able to receive financial assistance. So it's been especially beneficial for many households. And the ways that we give financial assistance is in the form of a tax credit, or you could choose a cost-sharing reduction. Also, Maryland expanded the Medicaid program, so we've had even more Marylanders enroll in Medicaid as well. We just finished open enrollment at the end of January. This was our third enrollment season, and we were really pleased with the results. Our overall enrollment increased about 33%. So this year we had more than 165,000 Marylanders enroll in healthcare for 2016. And that is about 500,000 people for the marketplace in total. So that includes qualified health plans as well as Medicaid. And we had about 30,000 enrolled in our dental plan, which is a huge number, especially since this was the first year that we offered it. We were also really pleased with our enrollment in certain communities that we were targeting. We were reaching out largely to the Hispanic community, and we actually saw a 244% increase in enrollment in the Hispanic community. So we were really pleased with that. Also with the African American community, we did some targeted outreach there, and we saw over a 35% increase in enrollment. So some of these numbers, we also did outreach to the Young Invincibles. We participated in a trivia night, which we thought was really fun, and we saw an increase in enrollment in Young Invincibles, which is age 18 to about 30, who are, they think they're super healthy, so they don't need health insurance. So to see an increase in enrollment in that community we were really pleased with that too. Let's see. So as I mentioned, we have our connector entities, which we kind of call our boots on the ground. And so if someone needs healthcare, they can go in person to their offices and enroll. Brian is the head of our Western Region Connector entity. So we'll talk about that. We have 6 connector entities, and you can kind of see the colors on this map is the region. So Bryan's is the largest region. They cover all the way from Garrett to Howard County. And then, as I mentioned, the capital, or the central region we call it, which is Healthcare Access Maryland, covers Baltimore City, Baltimore County, and Anne Arundel County. And we were supposed to have our representative here today from HCAM, but she has a young baby at home and she didn't want to travel in the snow with the baby, so I'm just going to cover her region. Her name is Lena Hershkovitz, and she's the Vice President of Health Insurance Programs for the region that I mentioned. HCAM also covers the local health department and the Department of Social Services in these counties as well. So if someone wanted to apply for health insurance, they could also apply for other benefits that they might need as well. And so you've probably heard of navigators that work for Maryland Health Connection. HCAM employs the navigators that have the ability to help people actually enroll in healthcare. So I think for your purposes, if you do come across someone that needs coverage, you can suggest they go in person to talk with a navigator and find out, how to enroll and what the best health plan is for them. And actually, HCAM has a satellite office that they open in Reisterstown during open enrollment, which is pretty close by. They also have a location in Baltimore City and another satellite office in Pasadena. It is important to know that Medicaid enrollment is year-round. So you can suggest that people try to apply for health coverage at any time of the year. Maryland Health Connection does have an enrollment window. We're still waiting to determine the enrollment period for the next enrollment season. We usually follow the federal government's open enrollment, and they're still kind of debating. So we're hoping it will be October. It'll start. This year was October 1st until January 31st. Let's see, enrollment. Oh, another important element of enrollment periods is that we have something we call a qualifying life event. So if someone has a child, or maybe they lose their job and they lose their health care with their job, or they have an income change, maybe they keep their job but their income changes, they can also try to enroll in Maryland Health Connection, and we call that a qualifying life change. So they would go online and try to enroll. HCAM's navigators will also go out to community events, as will someone from the Maryland Health Connection. So if your church was interested in hosting a health fair and they wanted to have someone talk about health coverage, we would be happy to come out and participate in that. And these are their satellite office locations, as I mentioned. And also, we'll skip that one. Lena wanted to make sure that everyone had her contact information, because if you wanted to have some postcards that have their address and locations and when people can go and enroll, she's happy to give that to you as well. So that's her contact information. I'm going to turn it over to Brian to talk about the Western region and Healthy Howard.
Thank you, Jenny, and you stole a little bit of my thunder, but we do a lot of the same things, so that's to be expected. My name is Brian Mattingly. I'm the director of the Door to Healthcare, and Door to Healthcare is the program of Healthy Howard that is the connector entity for Western Region. Some of you may be more familiar with Healthy Howard. It's been around for many years. These are just some of the programs at Healthy Howard. There's the connector program. There's the re-entry program, which I'll touch upon because that's part of my program. We have a community care team. We also operate the local health improvement coalition, Maryland's Healthiest Maryland Businesses, and Journey to Better Health, which is a faith-based health initiative we have. And the nuance on that I'll just touch upon briefly is we form MOU arrangements basically with health congregation, faith communities in 2 zip codes in Columbia. And really, we work on improving the health of the congregants there. And we may do that through health education, may offer classes. Also, we'll do like health screenings after services. So that's just a few examples of that. As I mentioned, Door to Healthcare, Western Region, is the connector entity. I want to touch upon the role of navigators and assisters. Again, as mentioned, enrollment in Medicaid and health plans will help with eligibility determination, facilitate plan selection. And unlike a broker who may recommend a plan, our role is to educate and empower the person so they can really choose the best plan for themselves. And also we do application follow-up. Sometimes there's questions or some management of the enrollment that we'll assist with. We also do community outreach and education, and then also health literacy, which again is more and more of a priority because what we've seen is now that people have health coverage, how do you use that health coverage? And it really is a critical piece to being successful with your health insurance. This is my territory that I cover. It's Howard, Carroll, Frederick, Washington, Allegheny, and Garrett counties. We have 14 partner organizations throughout the region, and I just wanted to list the ones here. In Carroll County, we partner with Partnership for a Healthier Carroll County. And in Howard County, we're with Chase Brexton Health Services and Fern. And Fern works with the foreign-born population in Howard County. We also work extremely closely with the health departments and DSS offices in each county. So for open enrollment, here's some of our locations where we were located this past open enrollment, just to give you an idea of kind of where we're located to serve the community better. Health departments and DSSs in both counties, also at Access Carroll, Carroll Hospital Center, and Eldersburg Library in Carroll County. And then again in Howard County, Chase Brexton, Fern. We were also at the 50+ Center in Ellicott City, and the reason for that was research showed that there was a high concentration of uninsured population in Ellicott City, so we wanted to kind of be at a convenient location to serve them better. And then also the Laurel Multi-Service Center, again, there was a concentration of uninsured down in that part of the county as well. So even though we have locations, I really want to emphasize that the best thing to do if you work with one of your congregants who's uninsured, encourage them to call if you're in one of my counties. And the reason I say that is because we want them to be prepared for success when they come to see us. And there's a bit of a triage process with that. We want to make sure they have the right documents with them and really have kind of prepared to sit down with us and in one session be successful with their enrollment. So this is the information on the number to call. They can also go to our website to get information and resources as well. I mentioned the reentry program. As part of the Connector program, we work closely with the Howard County Detention Center. And what we do is, when people are discharged from the detention center, we actually will be notified of that, and we will actually sit down, enroll that person in insurance, and then also help with them and their family to enroll and connect with local resources. And the benefit of that is, when someone was incarcerated, now they're coming out, we want them to be successful in the community. Also, the detention center wants them to be successful. So it's a very well-balanced relationship there. Some community outreach and education we've done. We'll do community events, health fairs. We work closely with community service organizations, really to kind of educate those frontline staff so they can they can spread the word for people they assist. We also did a lot of work with faith communities, job development programs, and also tax preparers. I mentioned faith communities. We were at Celebration Church in Columbia for their Super Health Sunday event, and we had navigators there who helped to enroll people after their services, which was very successful. And there's a little clip from an article in the Baltimore Sun. And this is health literacy, and that did not print right. So, but the quote there is more than 4 in 10 uninsured don't know basic health insurance terms, and fewer understand complex coverage concepts, and that's from the Kaiser Family Foundation. Health literacy isn't just needed for people who are newly insured. I've been fortunate enough, I've had health insurance my entire life. I've just had the type of jobs and opportunities that gave me health insurance. And let me tell you, knowing health insurance and how to use it, it's unfortunately through experience, which is a very hard experience sometimes with some people. So health literacy is just so critical because health insurance is complicated and the health system is complicated. So we're here to educate. We also work closely with organizations like the University of Maryland Extension, who prepared various resources to help people better understand their health coverage. And I do also want to emphasize, Medicaid is year-round. A lot of people don't realize that. And it's unfortunate when people come to us during open enrollment and they could have enrolled months ago. Delaying health insurance just delays, as Jenny said, in being proactive about your health. So it's really important that people know that they can get health coverage when they become available. She also mentioned special enrollment periods. And these are things like, as she mentioned, marriage or divorce, birth or adoption of a child, change in income, also moving to the state, or sometimes moving within the state may make you eligible to enroll. The best thing to do if you have a question is call Maryland Health Connection, or even call us, and we will help you work through the process. And this is back to you.
Yep.
I'll hand off. Thank you.
Yeah. Thank you, Brian.
Sure.
So, actually, I wanted to thank a few people, especially Reverend Mason. As Brian mentioned, we organized something called Super Health Sunday this year, and Reverend Mason helped us with that. And we found it to be a really unique project where we connected with faith leaders as yourselves around the community, because we realized that health insurance is kind of one of those topics where someone that you trust is going to be the person that you listen to about healthcare. Recently, my brother-in-law actually lost his job, and he asked me, what do you think I should do about getting healthcare? So in recognizing that need for trust and confidence, we reached out to the faith community to participate and kind of arrange this Super Health Sunday, which, as Brian mentioned, we had different navigators from our connector entities go to different faith organizations throughout the state to help their congregation members enroll in coverage. And so this is something that we're hoping to do again next year, and hopefully even more than one Sunday or Saturday, whatever's the most conducive for the congregation. So I have my cards with me today, and I hope that you'll take my card and keep in touch with me. I'm happy to send you materials and work with you throughout the year to educate and inform your community members about getting covered, especially if you come across someone that needs health care. So let's see. So that's the role of faith leaders, is we're relying on you for that trust in your community. And if you take away anything from this presentation, just remember that Maryland Health Connection is there to provide affordable health care for the state of Maryland and our community members. And know that you can call me at any time. You can reach out to Brian, and we're happy to connect with you to help with, even if it's just one person that you come across that needs health care. Also, on the back table, we both brought some of our materials. Right now we have what's called After You Enroll brochures, which covers some of those how to use your, thanks, how to use your healthcare topics. And as we get closer to open enrollment, we'll have even more materials that cover some of the dates and things you need to bring in when you go to enroll, stuff like that. And also, if you get some time, you can check out our website. We have a download center on our website where you can find some fact sheets about Maryland Health Connection. And we're also working to make some about special topics. So I just wrote one last week about a special enrollment period for victims of interpersonal violence. And that might be something you come across in working closely with the community. They can actually enroll at any time if they've suffered violence. So there's special topics on our website that you can find out about and how Maryland Health Connection can help with that. Outreach materials. And this is my contact information. I have my card with me too, but feel free to reach out to us at any time. And we're also happy to answer questions if there's something that if you have any questions for us.
Is your network also available to seniors who don't have a secondary while they're eligible for Medicare also?
For seniors, are they on Medicare?
They're on Medicare.
Okay.
They're looking for secondary.
You know about that?
So for someone who's receiving Medicare, they already have a qualifying health coverage. So the marketplace is really for someone who doesn't currently have qualifying health coverage. So they wouldn't necessarily go there to enroll. However, with regards if they wanted to enroll in dental, I wouldn't see why not, because that is a standalone service.
We've also found there's a lot of seniors in Maryland that that are from other countries that haven't paid into the taxpayer system long enough to actually get Medicare, and so they have a green card, but they're not eligible for Medicare. They are eligible for the Maryland Health Connection. So that's a great question, and something we've come across a lot within the community. Yes.
I have a 25-year-old son who is employed full-time, but his deductible from his company is $5,000 a year.
Oh, wow.
And that's like a quarter of his annual salary. Would something like this program be able to help him with his deductible and his prescription medications, which he cannot afford?
I think, can he opt out of his plan, or?
Yeah.
So he would have to be a member of the state plan and not his employer's plan in order to get resources from.
For eligibility to enroll through the Maryland Health Connection, there's two criteria. One is, do you already have a plan that provides essential health coverage, which his probably does. Also, there's an affordability measure, and if he's paying 1/4 of his income, he'd be able to enroll through Maryland Health Connection, because that's excessive.
So even though he has a policy from his employer with United Healthcare, he could still qualify for deductible health insurance or deductible help and prescription help with the state.
Yeah, he should, and what I would recommend is, and this is an example of call, because the person can on the phone and kind of walk them through the process, assess whether or not what they would be eligible for, and then make sure they show up with the proper information. So in his situation, he'd have to bring information about his current health plan. He'd have to get from his HR department probably.
Yeah. Thank you very much.
Sure.
Any other questions? Okay. Thank
All right.
you.
Yes, thank you, everyone.